Have you ever felt that quiet heaviness settle in your chest? The kind that appears when the house is silent and the days feel a little too long? A patient of mine once told me that loneliness felt like a shadow following her from room to room, growing darker each year after she turned 60. I want you to imagine something with me. Picture your heart and brain working together like two lifelong partners. Now imagine what happens when one of them starts carrying the emotional weight alone. Most seniors worry about stroke, but few realize that loneliness can raise stroke risk almost as much as high blood pressure or clogged arteries. It's a connection we rarely discuss in exam rooms, yet it affects millions of older Americans every single day. Loneliness isn't just a feeling, it is a state of chronic emotional stress. When it lingers for months or years, the body shifts into survival mode. Inflammation rises, blood pressure creeps upward, your blood vessels stiffen, and the brain becomes more vulnerable. These are not small changes. They are powerful triggers, quietly increasing stroke risk without making a sound. As we get older, this vulnerability grows. Retirement changes daily structure. The loss of a spouse leaves empty chairs and even emptier evenings. Children build their own lives far from home. Mobility slows down, health issues multiply, and social interaction becomes harder to maintain. Living alone often means long stretches of silence, endless thinking, and emotional withdrawal that no one else sees. In my years of caring for older adults, I've watched something remarkable. I've seen patients whose blood pressure improved, not from a new medication, but from joining a small community group. Science supports this too. Loneliness elevates cortisol, the stress hormone that stiffens arteries and weakens the brain's resilience. When cortisol stays high, stroke risk follows closely behind. In this video, we're going to uncover why loneliness raises stroke risk so dramatically, what emotional warning signs often appear before a stroke happens, and why so many doctors rarely talk about it. I invite you to stay with me, learn with me, and take this journey toward protecting your heart and brain. And if you find value here, I'd be honored if you subscribe so we can continue exploring your health together on Senior Health Daily. How loneliness physiologically raises stroke risk. When we talk about loneliness, many people think it is simply a feeling, something emotional, something personal, something that lives only in the heart. But the truth is far more complicated. Loneliness does not sit quietly inside us. It spreads through the entire body like an invisible ripple, touching systems we often take for granted. Over the years, I've watched how chronic loneliness slowly changes the way a patient breathes, sleeps, eats, thinks, and eventually, how their cardiovascular system responds to stress. Let me take you into the body for a moment and show you what happens behind the scenes. When a person feels lonely, the brain interprets it as a threat, even if nothing dangerous is happening. This is because, as humans, we are wired for connection. Connection was once necessary for survival. So when the brain senses isolation, it activates the same pathways it would use in an emergency. Cortisol, our stress hormone, rises and stays high. The heart begins working harder. Blood vessels tighten. Clotting factors increase in the bloodstream. Imagine your body stepping on a gas pedal but never releasing it. After weeks and months, the pressure builds. Blood pressure climbs. Arteries stiffen. The risk of a clot traveling to the brain rises. This is why lonely seniors often find themselves with numbers that surprise them during routine checkups. They say things like, "But I didn't feel stressed." And that's true. Loneliness does not shout. It whispers. It works quietly, tightening the body from the inside. Chronic loneliness also creates inflammation. Scientists have found that when emotional stress lasts too long, the immune system becomes confused and overactive. The inflammation that follows damages the lining of blood vessels. Tiny injuries form along artery walls, making it easier for plaque to build up. Over time, those small changes can become major risks. Inflammation is one of the silent drivers of stroke, and loneliness feeds it day after day. Sleep becomes irregular too. Lonely individuals often describe waking up multiple times at night or feeling unrefreshed in the morning. This poor quality sleep increases blood pressure and disrupts heart rhythm. Many of my patients reach for quick comfort foods when they feel isolated. These choices, usually high in sugar and salt, further strain the cardiovascular system. There is another layer to this story, one that most people never hear about. When loneliness becomes chronic, the body produces less nitric oxide. Nitric oxide is a critical molecule that relaxes blood vessels and keeps them flexible. Without it, arteries become stiffer, less responsive, and more vulnerable to the pressure of daily blood flow. Stiffer arteries mean higher stroke probability. The science is clear. Studies show that lonely seniors have up to a 30% higher risk of stroke. 30% is not small. It is not something to brush aside. It is a real, measurable danger. And yet, most seniors have never been told that loneliness can physically reshape the body in ways that increase stroke risk dramatically. This is why understanding the physiological impact of loneliness is the first step. Because once we understand what loneliness does to the body, we can begin to talk honestly about what it does to the mind. Emotional health and stroke. I want you to think about a moment in your life when you felt deeply disconnected. Maybe it was after losing a spouse. Maybe it was after retiring and realizing your daily conversations suddenly disappeared. Maybe it was a holiday when no one called. That emotional heaviness, that quiet ache, is not just sadness. It is a signal from the emotional centers of the brain asking for connection. And when those signals go unanswered for too long, something unexpected happens. Loneliness amplifies anxiety and depression. These two emotional states disrupt the heart's natural rhythm. The sympathetic nervous system, which controls our fight or flight response, begins to dominate daily life. Even simple tasks feel heavier. Thoughts become sharper, more negative. The mind loops through old memories or worries repeatedly. This rumination activates the body's stress response over and over, increasing the load on the cardiovascular system. When the mind cannot release emotions through conversation, companionship, or human presence, it holds them inside. I often call this internal pressure. It is emotional, but it is also physical. You can see it in the way someone sits, in the way their shoulders rise, in the way their breath shortens. Their body becomes a container for unexpressed feelings that quietly influence heart rate, blood pressure, and neural activity. You might be surprised to learn that emotions literally change the movement of blood in the brain. Brain scans show that when people feel lonely or distressed, blood flow shifts from regions responsible for connection and empathy to regions responsible for fear and survival. It is as if the brain becomes trapped in a storm, waiting for something to go wrong. This is not because individuals are weak or overly emotional. This is biology. It is the nervous system doing the best it can to adapt to prolonged isolation. When those emotional storms last too long, they wear down the body's resilience. The heart becomes more sensitive to spikes in blood pressure. Blood vessels lose some of their ability to respond to stress. Stroke risk builds layer by layer until the body reaches a tipping point. This emotional layer of stroke risk is one of the most overlooked areas in modern medicine. Yet in older adults, it plays a huge role. Loneliness changes the mind, and the mind changes the body. And once the emotional landscape shifts, it opens the door to a series of hidden triggers that many seniors never see coming. Hidden stroke triggers. After 60. Once my patients understand how loneliness affects the body and the mind, they often ask the same question. If loneliness is so harmful, what are the actual moments that push the body closer to a stroke? The answer is rarely simple. It is not one dramatic event. It is the accumulation of small, repeated experiences that many seniors overlook because they have become part of daily life. One of the most significant triggers is living alone without regular emotional interaction. Many seniors tell me they enjoy peace and independence, and that is wonderful. But independence becomes dangerous when silence becomes the dominant sound in a home. Silence leaves too much room for internal stress to build. A day without conversation may feel normal. but a month or a year without meaningful connection slowly rewires the body's stress system. Another hidden trigger is long periods of stillness or inactivity, when someone spends most of the day seated because they feel unmotivated or emotionally drained. Circulation slows, blood becomes thicker, arteries become more strained. That slow, steady stagnation increases stroke risk in ways most people never realize. Touch is another factor we rarely discuss. Humans are wired to respond to physical warmth. A hug, a hand on the shoulder, even brief contact reduces cortisol levels almost instantly. When seniors go weeks or months without physical touch, cortisol stays elevated and inflammation rises. Eye contact, conversation, and shared laughter provide similar emotional relief. Without them, emotional stress deepens. I have also seen how chronic worry plays a role. Finances, health, the future. These thoughts can become companions in the absence of human connection. They create tension in the chest, a racing mind, and a constant undercurrent of stress that strains the cardiovascular system. Unnoticed hypertension is another danger. When people live alone, blood pressure often goes unchecked for long stretches. No one notices the headaches, the fatigue, or the redness in the face. And because stroke risk climbs silently, those opportunities to catch early signs are often missed. Medication routines can suffer as well. Many lonely seniors lose the motivation to stay consistent with their pills. Some forget. Some think it no longer matters. Some simply feel too tired to keep up. Inconsistent medication increases stroke risk dramatically, especially when it involves blood pressure or heart rhythm medications. Then there is the lifestyle shift that loneliness invites. Emotional fatigue leads to less movement, less sunlight, fewer nutritious meals, more processed foods, more nighttime snacking. It slowly transforms a once active person into someone whose body is working harder every day just to keep the heart and brain supported. I remember a patient who lived alone after her husband passed. She told me she felt fine. But after talking with her, I realized she hadn't spoken to anyone for days at a time. She had stopped going for walks. She had started sleeping late, eating irregularly, and skipping her medications occasionally. Her blood pressure had risen sharply. It was not because she was unhealthy. It was because she was alone. Loneliness changes habits, and habits change health. This is why understanding the hidden triggers is so important. They do not announce themselves. They blend into daily routine, shaping the body quietly until symptoms appear. And by the time they appear, stroke risk has already grown significantly. Before a stroke happens, the body often sends emotional signals, and that brings us to the next section: senior loneliness warning signs. When I talk with seniors about loneliness, many tell me they are not lonely. They say they are simply independent or private. But loneliness does not always look like sadness. It often appears as subtle shifts in behavior that many people dismiss. These changes matter. They are not personality flaws. They are early warning signs of emotional distress that can increase stroke risk if ignored. One of the first signs is withdrawing from social activities. Someone who once enjoyed small gatherings suddenly stops attending. They begin turning down invitations with excuses like feeling tired or not wanting to be a burden. Another sign is talking less. When people speak less, they process emotions alone. That internal processing creates pressure that affects both the mind and the cardiovascular system. Some seniors describe a strange feeling of emotional numbness. They cannot quite define it. They just feel disconnected, as if the world is happening around them rather than with them. This numbness is a sign that the brain has shifted into emotional protection mode, reducing resilience. Changes in appetite are another clue. Some people lose interest in food. Others begin eating more for comfort. Both patterns disrupt the body's natural rhythms and affect blood sugar, blood pressure, and inflammation. Sleep changes also appear. Loneliness often leads to light, shallow sleep, or waking up frequently at night. Poor sleep disrupts blood pressure regulation and brain function, increasing vulnerability to stroke. Irritability, sudden sadness, or unpredictable emotions are also signs. These shifts are not someone becoming more difficult with age. They are signs of emotional overload. When the nervous system is strained for too long, it becomes less flexible, leading to quick emotional reactions. One of the most common phrases I hear is, "I don't want to bother anyone." That sentence is a sign of deep emotional withdrawal. It signals that the person feels disconnected and unworthy of support, even if their loved ones would gladly be there for them. These signs deserve attention because they are often the body's way of saying, "I need connection." When ignored, they become part of the chain of events that push stroke risk higher. Now that we understand the signs, let's talk about why this topic is rarely discussed in medical settings. Why doctors rarely admit this. You may wonder, if loneliness is such a significant health risk, why do so few doctors talk about it? The answer is complex, but important to understand. Medical training focuses heavily on physical symptoms: blood pressure, cholesterol, heart rhythm, name, imaging results, lab reports. These are measurable. They are concrete. They are easy to track. Emotional health, on the other hand, is harder to quantify. There is no lab test for loneliness, no quick screening that shows emotional stress levels. Appointments are often brief. Most doctors have only a few minutes to address patients' physical concerns, and when someone comes in with headaches, fatigue, or high blood pressure, the focus naturally shifts to medical management rather than emotional causes. Insurance systems often encourage quick diagnosis and treatment rather than deep conversations about social connection. Another challenge is that many seniors hide their emotional struggles. Pride plays a role. Generational norms play a role. Many older adults grew up believing that emotional needs should remain private. They minimize loneliness, saying it is not a big deal. They say they are fine when they are not. This makes it harder for doctors to recognize the deeper issues beneath the surface. There is also an assumption that families will take care of social needs, but many seniors live alone, and not all families live nearby. Adult children work full-time. Grandchildren have their own schedules. Lives become busy. The support system that doctors assume is present is often not. Yet, despite all of this, emotional health should not be optional. It is protective medicine. It is as essential as managing blood pressure or diabetes. In fact, it directly affects both. This is why I believe strongly in talking about loneliness openly. Emotional health is not a side conversation. It is central to preventing stroke and preserving independence. Understanding this opens the door to the most important part of this discussion. What can seniors do right now to protect themselves? What seniors can do today? Now that we understand how loneliness affects the body, the mind, and overall stroke risk, the most important question becomes, what can you actually do today to protect your health? You do not need dramatic lifestyle changes. You do not need expensive programs. You do not need to be surrounded by people every minute of the day. You simply need consistent connection, caring habits, and small steps that rebuild emotional resilience. Daily connection makes a profound difference. A 10-minute phone call with a friend or family member lowers cortisol and stabilizes blood pressure. Joining a walking group not only improves circulation, but also creates opportunities for conversation. Visiting a senior center once a week provides structure, laughter, and a sense of belonging. Even simple video calls with loved ones can eliminate the emotional weight that builds during long stretches of silence. For many, faith communities become powerful anchors of connection and peace. Emotional self-care is just as important. Journaling is not just writing, it is releasing the thoughts that would otherwise sit heavily on the mind. Breathing exercises calm the nervous system and lower stress hormones. Listening to uplifting voices, whether in music, podcasts, or positive videos, can shift emotional patterns. Practicing gratitude brings the body out of survival mode and back into balance. Small emotional habits create measurable differences in both mental and physical health. Physical habits also counter the strain that loneliness creates. Light movement for 20 to 30 minutes a day improves circulation and reduces inflammatory markers. Drinking enough water supports heart function. Choosing anti-inflammatory foods such as berries, greens, nuts, and fish helps keep blood vessels flexible. Establishing a consistent sleep schedule strengthens the body's natural healing processes. Checking blood pressure regularly gives you insight into how your body responds to stress and helps you catch early warning signs. Supporting the brain and heart means staying mentally engaged. Reading groups, puzzles, or brain games challenge neural pathways. Omega-3 rich foods strengthen the heart and reduce inflammation. Volunteering creates purpose and connection, two powerful buffers against loneliness. Learning something new, even something small, gives the brain a reason to stay engaged. Purpose is medicine for the aging heart. And perhaps most important of all, seeking help should never bring shame. Loneliness is not a personal flaw. It is not a failure. It is not a sign of weakness. It is a health condition, just like high blood pressure or diabetes. And just like those conditions, it deserves care, attention, and support. In my years of caring for seniors, I have seen people rediscover joy, confidence, and emotional strength simply by taking small steps toward connection. When emotional health improves, stroke risk drops. Families reconnect. The heart steadies, the brain becomes more resilient, life becomes brighter. You deserve that. You deserve a life supported by connection, compassion, and understanding. Loneliness may raise stroke risk, but connection can rebuild the foundation of your health. When we take care of the mind, we protect the heart. And when we protect the heart, we safeguard the brain. It all begins with small choices made today. As we come to the close of this conversation, I want to bring you back to the heart of our message. Loneliness is powerful, but so is awareness. When you understand what loneliness does to your body and mind, you gain the power to change the direction of your health. Stroke risk is not fixed. It responds to connection, to understanding, and to the small, consistent habits you choose each day. Even the gentlest steps can open doors to healing. And in this moment, I want to honor the strength within you. Your body has carried you through decades of experiences. It has endured seasons of joy, loss, growth, and transformation. It has carried you through storms you thought you would never survive. It deserves care. It deserves compassion. It deserves kindness from the one person who can offer it most deeply. You. There is always hope, no matter your age or circumstances. Reconnecting with others, even in small ways, strengthens the heart and protects the brain. Emotional health is not separate from physical health. It is a form of medical care, a form of nourishment, a form of protection. When you reach out, when you open your heart to connection again, you are choosing life, vitality, and resilience. And I want you to know that you don't have to walk this path alone. Here at Senior Health Daily, you have a community that cares about you, understands you, and wants to support your journey toward a healthier and more connected life. I am grateful you spent this time with me today. It means more than you know. Thank you for being here. Thank you for caring about your health. And if this message resonated with you, I invite you to subscribe so we can continue growing together. Your story matters, and I'm honored to be a part of it.